When a person gets a bite from an animal they don't know, the question I'll most often hear is, do I need to worry about rabies? And the answer is, unfortunately, it depends. There are a few important things to keep in mind when we're talking about rabies. First of all, rabies is almost 100% fatal. It is the most lethal infectious disease in humans. Second, rabies can only be carried by mammals. If an animal has fur, it can carry the virus in its saliva, its brain, or its spinal tissue. Third is that rabies has an incubation period where a person who's bitten can get treated. If a person's bitten, the rabies virus will march backward from the nerves around the skin where the person was bitten at about the rate of about a third of an inch per day. That length of time is where we can treat that person effectively for the rabies virus and stop it before it gets to the person's spinal cord or brain and actually causes the disease of rabies. If you do get bit by an animal you don't know, get to an emergency room or to a physician's office to be evaluated. Animals that carry rabies are, in the world, dogs. And so it's important, especially when you're in a country where the majority of dogs are not vaccinated for rabies, that you get prompt treatment for any dog bites. In the US and other countries where we commonly vaccinate, we mostly see these from people handling bats. Most importantly, don't panic. Get seen promptly for treatment, but remember that this disease can be prevented.